Going back to the idea about surgery, and you're going to love this one. Everyone, it's going to try and kind of corral you into a corner here. Everyone's asked me. I mean, not everyone, but so many people have asked me about surgeries, particularly first of all the knees, and then it's sometimes, unfortunately, the shoulders. And we had a discussion actually a while back, didn't we, on social media about a shoulder. Operation, of a well-known teacher, and having a shoulder op. I had a couple of knee ops in my early days. In fact, when I met you, I was suffering with a meniscus tear, I think. I had them operated on in my 20s. Successful, I have to say. You might get my general tenure here as not a massive allopathic medicine fan, but they were successful. I have to say that the operations in my early 20s did stop that pain, and subsequently I went on to do stupid, crazy things with the knees, and like Mula Bandhasana and this kind of silly turning over of the knee and legs, and they were always okay. I have to say, with the one or two flare-ups, but so that's all I can say really. But I mean, you must have seen a lot more bodies, and do you have anything to say about? I know that you can't say categorically, you should have surgery or not, but I mean, people do have this in their mind, quite a lot. So is there anything you would say to people thinking about this proposition on knees or shoulders particularly?
Yeah. Well, there's a few ways to come at it. Again, it's not a black or white issue in my mind. Depends on, for instance, if we talk about a meniscus tear, I had surgery on my meniscus
as you?
Well. Yes, I did. And, my doctor, when I first went to see him, it was classic signs and symptoms of it. And, this was well into my practice, maybe 6, 7, 8 years in, something like that. And I was bringing my leg into lotus as I had done a million times prior. And there was a audible click, and then, it was hard to put weight on that leg. Those are classic symptoms of a meniscus tear. When I went to see the doctor, because, I'm open to the information, it's like you go to a surgeon, expect them to offer to solve the problem by doing surgery. We shouldn't be surprised by this. Just like you go to the GP and they're going to offer you drugs to solve your pain or problem. We shouldn't be surprised by these things. That's fine. No. I always take the perspective that you're my doctor, I'm not your patient, and just in framing it in my mind where I'm going to get information from you based on what you know and make my own decision, of course. That's why I always encourage people to go with that type of perspective rather than just because you went to see the doctor doesn't mean you have to do what they say. So anyway, the doctor was like, it's a classic symptoms of meniscus tear. He's like, if you want, we'll do an MRI just to confirm. We did an MRI. There was a small tear there. I went back to see him. He's like, look, it might resolve itself. It might not. He's like, there's no harm in, take a year, or 6 months, or see how you feel. If it's not bothering you most of the time, then, you don't want to do anything, that's fine. But he also described the surgery, as, like getting a tooth filling, I think, something like that. We consider this very minor surgery these days. It's not like big open surgery and blood everywhere or whatever. So I went off for about 2 years and didn't do anything, and did all of the things that I do with any time I meet a student with knee problems, inner knee pain, all of that stuff. And it did get better, but there was always a tentativeness and a caution based on sensation. Like and then it clicked again, and I decided to go ahead and get the surgery. And I stayed awake for the surgery. The doctor was allowed me to stay awake. I thought I was being brave. I don't know. I was curious and interested to see. He was up for it. They checked and confirmed like 3 times that you sure you want to do this? Because once we start, we're not stopping, kind of thing. Kind of stuff. Of course, I did get a nerve block at the knee, and that hurt that's what hurt. That's the only thing that hurt, actually, was, basically putting a needle in a nerve and injecting it with something so I didn't feel anything.
You just got it in the knee. I got an epidural in the spine, actually. And in India, this was in India, and we had it, I stayed awake completely, but it was wonderful because I had some kind of morphine going on. So I was laughing all the way through. Fantastic. And all the surgeon was also laughing as well, and poking around and going, look at this.
Yeah.
Showing me.
I got an anatomy quiz as well from the doctor. No morphine. I didn't get any drugs that way, but,
Shame.
But
get your money back.
Whether I needed it or not, I mean, here's the other way I frame it for people. I'm like, look, if you tore your meniscus, it's never going to be like it was, right? Even if it repairs on its own, it's got to have some scar tissue. Something's got to hold it together, or it's going to literally break off and float around in your knee. There's nowhere for it to go. It is a joint capsule, and it's called a capsule for a reason, because it's encapsulated. What's in it stays in it. I mean, there's a change of fluid through membrane, but your piece of cartilage or floaty bits of your cartilage are not going to get out from there, which potentially causes problems. Not always, but those pieces can get jammed up in between, the head of the not the head, but the femur ends and the meniscus itself. If you do surgery, it's also never going to be like it was. So in that sense, they're both equal. So the question is, everybody, throws out the ahimsa word for a reason to not get surgery. But
I haven't heard that one. Right.
Yeah, do no harm kind of thing.
Right. I understand the idea. I just haven't heard it. I mean, it's a hard one. And I think, it's like, I wouldn't probably have it done now, like at this age, kind of 20 years later. I think that the possibility of recovery is going to be less. That's often,
I mean,
the best
the other thing to remember is with meniscus surgery specifically, there's nothing that needs to heal after they just remove a piece that is broken.
Yeah, it's getting stuck. It's getting caught in the joint.
It's different if it's if you're trying to there's different types of tears without getting into the weeds, but if it's longitudinal, like what they often refer to as a bucket handle tear that's going in the shape of the meniscus, those they try to stitch up. Then there's a healing process there. But what most people end up with is a removal of a small piece of the meniscus. There's nothing to heal. There's no blood in there. It's over. There's stiffness.
I think a lot of this also depends, on weighing up what you want to do with things. Knowing that the surgery is always a risk. It's like, well, how much do you need to do this with your body? Whether it's a shoulder or a knee, it's like, well, do you really need to do handstands all the time, or that's what I think the doctor will say to you anyway. Well, show me what you're doing, and you kind of say, well, my leg, I want to put my leg like this, and they go, well, why? Why is that necessary? And then you say, well, I can't run for a bus, and they go, well, okay, that's fair enough. You probably need to.
It's true. It's a good point as well.
But it's like, well, what do you need to do? I think is probably, or how much do you need to do that lotus? Is another question that's worth, in terms of just general everyday pain as well. I was going to ask you, I suppose, knowing that hips are a big issue, and then the knees are affected. There's so much lotus stuff very early on in the sequence. I mean, do you recommend kind of pre-yoga stuff? Because the sequence itself presupposes a level of opening. Really, it doesn't. Yes, it does facilitate to degrees a level of but it also kind of presupposes an ability to an open enough hip that you're not going to hurt your knee, right? So, having had one yourself, me having had two, do you recommend people do stuff pre to this sequence of Ashtanga yoga?
Yeah, I think you're spot on. I think John, once said, from a cultural perspective, the practice comes out of a culture where sitting on the floor, crossing your legs, possibly sitting in half lotus, that's normal and regular. At least it used to be. Whether it is now is another question. Or less so now, maybe, is the best way to say it. So, yeah, it does. I do think the practice presupposes it. I am a fan of, instead of doing sort of a pre-practice warm-up type of, or sequence or preparation or whatever, I prefer to do it right before doing the posture that is potentially problematic. And the reason for that is because when you do the preparation, you're going to create a temporary change in the tissue, right? You're going to open it up more, right? The fascia is going to open, maybe the nervous system and the musculature itself also, relaxes more or gets stretched out, or without getting into the weeds of the details of what literally happens inside the body. The change is temporary. So in my mind, it makes the most sense to make the temporary change right before you're going to do the posture.
Okay.
So I prefer it early on.
What about the Vinyasa police? You're going to get, get done by the, a ticket from the Vinyasa police, aren't you? You've lost all your magic Vinyasa.
Yeah. Well, you can do preparation with Vinyasa, with breath, movement,
no, it does make
synchronization.
Sense.
Right? You can maintain focus. But
yeah.
You're giving up one thing for another anyway. We often end up in a situation where, even including alignment, you give up depth of a pose for alignment's sake, or you give up the Vinyasa to keep your knee safe or healthy or less problematic. So, should you keep your foot down, or should you, bind your front hand, and people can make arguments for either of those if they want to, but we're often in a situation where we give up one thing for another anyway. The question is, why are you giving up what you're giving up?
That's a great way to put it. And let's go further and say, well, yoga, to look at the Bhagavad Gita, there's a whole section of saying that yoga is sacrifice, that the yogi sacrifices, it sacrifices something, right? And that's the kind of the whole tenet of the method of yoga. Even to sacrifice your one's wish to get into postures. And on that note, I mean, how much does one push to get into postures? Because you see people repeating things again and again. There's a certain amount of force involved. We have the classic Ashtanga adjustments. Does it work to push oneself into positions? Does that open? Does that open the body? Does it create? Do you think? I mean, my feeling, if I just patiently clear with my own thoughts, is that the posture should flow naturally, and if there's a level of strain to get into the posture, it's work behind you, not pushing into that posture to get it. That there should be a degree of comfort when one enters that posture, even on the first time. That jamming oneself into the posture suggests that there's a lack of opening, which isn't, in my perspective, going to be facilitated necessarily by just pushing more into that posture or doing it 20 times or something, as we used to be told. Just do it again and again and it will somehow work out. But I don't see it that way.
I mean, I think it's, in the early days of starting a practice, there's always going to be more effort on all levels, on focus, on concentration, on paying attention to one's breathing, and then as we get into the postures themselves, of course, the tissue's less open. There's, it takes more muscular, even if we don't add on things like, grabbing with our hands and pulling ourselves in deeply, there's still a place where there's not just the flexibility of what you're up against, the resistance, that flexibility, let's say forward bend hamstrings, right? But there's also the strength of your hip flexors relative to that flexibility, right? And so when there's less flexibility, it's going to take more muscular effort on the other side to pull yourself into the posture. That by itself isn't a problem. Yes, when you start adding things on and repetitive, then, I think there is a point where you cross some line that is hard to define where it becomes less productive.
What do you think about yoga adjustments generally? I mean, you're a fan of pushing people. I mean, because people say, "Oh, they feel great." I'm constantly arguing with this online, because I kind of quite like teaching online. So, but I miss the adjustments in not everyone, obviously. I'm relatively popular, but I miss going back to the studio and getting those adjustments. They feel great, and that's the only way I can deepen into Kapotasana if I'm put into it, and I'm never going to get it otherwise. Do you have anything to say about adjustments and how you adjust?
Well,
Because I know you adjust quite differently, so
yeah,
interested.
I am a fan of adjustments. I think they can be extremely helpful. Of course, people can get injured from adjustments as well. I don't discount that part. But, there's basically two ranges of motion. There's the unassisted version of range of motion. Let's say we just use forward bend again. I forward bend as far as I can without using anything but muscle versus muscle, like we were just talking about, hip flexors versus hip extenders, right?
Yeah. Isn't there an acronym for that? Like active range of mobility and passive range of mobility or something like that? Yeah. Like a POM or something like that, wasn't there? POM and something else.
Either way.
Anyway, yeah.
That is what I refer to as unassisted range of motion. The moment you take your hands and you grab your foot, you are assisting yourself in the forward bend. Yeah. And you're always going to get further that way because you have more muscles, more force to work against the resistance that you're against. So, having said that, the same is also true when you do an adjustment. I mean, not all adjustments, of course, are about deepening.
Yes.
Right? That's definitely part of it. And of course, the person can't get there on their own because they can only go so far without assistance, whether it's them or the teacher. But the other thing that happens with, consistent adjustments, let's say, is the body kind of learns a new place to be. Like, if you passively take students to a deep place, I mean, that's not typically done in yoga class, or through adjustments. People are typically active as well. And so when you have the person being active in, let's say, the forward bend again, in addition to getting the extra weight or force or whatever you want to refer to that as, force isn't a negative word in this scenario. It's just more than what one could generate on their own. Then from a nervous system point of view, the body knows how to belong at this depth. It touches onto that, right? Doesn't mean it's sustainable. It doesn't mean it's going to always be that way on their own, or it's automatic or fast or whatever. The consistency of teaching the nervous system how to, sometimes, with that assistance, people learn to let go in certain places or find places where they're holding on to something and are able to let that go. I'm not talking about letting everything go, but, there's a certain process within that. Again, this all assumes that the adjustment is appropriate for the person on that day. And
that's the difficult thing, isn't it? Yeah. And being able to kind of see, and also, I mean, as you rightly say, the fact we can never really see what's going on with someone inside, short of doing an MRI at that very time. Do you know what I mean? You can never really,
yes.
You never really know, what is
you can never really know.
Yeah, but I suppose maybe I'd ask you, so you've seen or experienced yourself, perhaps, time and again, having had adjustments that you're able then to develop the range of mobility in certain postures. You've seen that.
Yeah,
that process happening. So
absolutely, and I don't think we shouldn't just limit it to a range of motion component of adjustments. The conversation in adjustments is both ways. It's not unidirectional. It's not an implication on somebody's body. It's you're putting something in and you're also listening. And I think this is the harder part to, for new teachers in particular to grasp. You're not imposing something on someone. Yeah. You're putting something in and listening for what's coming back and responding to that. you know, and I use the term kinesthetic empathy, meaning you have some sense of what the person is feeling based on what you've put in and the response you get back.
But also having a conversation. I mean, we haven't talked about the fact that, I mean, I know you talk to people a lot in the class, right? And ask them how they're feeling and, you know, and ascertain, you know, how different, I mean, what you give, I know, is a lot of different possibilities of doing something. So, I mean, that, you know, which is then wonderful once you've explained that, because, I mean, many people even might anatomically know things quite nicely, but if you're just getting pushed into something, you don't really know what the expectation is in the first place without a conversation as to what your own intention in the whole scheme of affairs should be, you know?
Yeah, intention is a big one anyway. So, which, I mean, I did a whole DVD and a bunch of videos on adjustments. And I mean, there's so many parts to it, but, you know, to keep things tight, you know, of course your intention is critical, you know, and I think, you know, it's where I think it becomes problematic when it creates a dynamic where the person feels like they need to surrender to whatever you're doing. I think that's where the probability or, you know, possibility of injury increases. If you're not paying attention and the person, you feel them tightening up, let's say, and you just say, oh, relax and push harder, you know, these are where the problems, you know, and not just even physically, but in terms of student-teacher dynamics and, you know, dealing with trauma, just to throw a popular word in there, this is where you start to create the pressure on these underlying things that there's really no need to do.
Yeah, as you say about the doctor, I mean, the question is the relationship between the two people, right? Isn't it? It's like the doctor isn't categorically the, you know, the omnipresent God there to heal you. It's more, and the yoga teacher isn't going to give you necessarily the right solution either. It's like there's information there, you know, there's all these different information givers, and it's a two-way street, as you say, and increasingly so, right, from the model of just. I mean, you know, because you know, there was a precedent set up. Let's be honest, with Pattabhi Jois, it was either kind of, you know, at the time of those adjustments that are originally given to the older students, it was a surrender or get broken kind of affair, right?
Absolutely, yes.
You know, but yes. Now, hopefully we've learned that, you know, that this kind of dynamic is, you know, it's just inappropriate for people to have this kind of relationship with a teacher, with any teacher, Western or otherwise, or, you know.
Yeah.